Okay, let's start our first table with some health professionals who are educated on this very topic to give us some perspective. Start with introductions. Welcome back to the show, James Sandler with St. Louis Urgent Care. We appreciate you being here. Also, Dr. Heidi Miller, Family Health Care Centers, regular on the show. We appreciate it. New to the show, Dr. Weldon James with Mercy. Thank you for being here as well. And Dr. Doug Pogue with BJC Healthcare. Thank you all for being here. I think I know you're going to say yes, but let's get this real baseline argument underway. Do young people really need health care? Do they really need insurance? And if so, convince me why they do. One at a time.
Absolutely. So,
because not everybody feels that way, obviously.
Yeah. Well, there's a number of issues, and we'll just walk through a couple of them. So, young folks still have problems that happen to them. Sometimes they're episodic. You're playing in a softball league, you slide into second base, and you blow your ACL, and your knee now needs surgery. That's a lot of expense that wasn't foreseen. Someone in their 20s who's just trying to get a job and make their way in their first apartment, that's a lot of money for them to suddenly be under the gun for that if you're paying off student loans and things. There's all kinds of downstream consequences for even simple things. People in their 20s often are active in the dating scene. Let's say, for instance, somebody, perhaps a young woman, picks up a sexually transmitted infection. Thinks about it, not sure if she should get it treated or not, but then kind of hangs around hoping it'll go away. Eventually it doesn't go away. And she shows up either in an emergency room where the cost of care is about 10 times what it would be in one of our offices. Or even if she does show up in one of our offices and she gets the right care right away as soon as we see her, if she's waited too long, well, some of these infections can leave scar tissue and other problems that affect fertility down the road. So now she's several years down the line, she's married, wants to start a family, having trouble having kids. There's tremendous downstream costs of not having insurance. You want people to have insurance so they can get the care that they need, not lots of care, but the care that they need right when they need it. And that leads to better health and it's lower costs long term.
So you asked two questions. Do young people need health insurance, and do young people need health care delivered by a primary care provider? And if you're going to ask, do young people need health insurance, you can ask young people themselves. And on a poll that Kaiser did in June, young adults were surveyed, and 70% of them highly valued health insurance. In terms of do they need health care, implying do they need regular health care, do they need access to primary care? Yeah, all day long. For that particular population, we are addressing behavioral health issues, obesity, sleep apnea, early diabetes, sexual health, family planning, the list goes on and on. And in addition, you have screening and annual physicals to do.
The myth of the young, invincible person is really just that. If you actually prompt them with a question between this population between 18 and 30, they'll say only 24, maybe a quarter will say, well, yeah, I am young, I'll live forever, I'll never get sick, and I don't need health insurance. Most will say, yes, I am worried about not having health insurance. I'm worried about something happening. In another conversation, yes, I would love to work maybe at this coffee shop as opposed to maybe this factory, and where I would have health insurance. And that's important. Most of them are worried about the future. They are worried about, let's say, a child who may have a pre-existing condition, and they're worried about if that family member would be covered. And this comes up.
I think one of the issues is there are people, obviously, that need health care. When we oftentimes see younger people, it's when they have an acute care need. It's when they have a mental health issue or upper respiratory infection or a sexually transmitted disease. Getting them to then continue on with primary care is a huge challenge. Young people don't want to just go in and say, hey, I feel okay, but test me.
It's my annual.
Right, it's my annual. And so I think one of the challenges once we get people actually enrolled in insurance is the outreach, is getting people to actually come in so we can start doing these screenings. In the African American community, we're talking about before the show that prostate cancer is very prevalent. One of the most effective ways that they did health education was going into barbershops and talking about prostate cancer, because it's a meeting place in that community. The same thing is going to have to happen for young people. We're going to have to really sort of reach out, go to where these people populate, where they congregate, and reach out. And that's going to be sort of an effort both by the federal government and hopefully by the city and state.
Go ahead.
So another way to ask the question is, what happens if you don't have health insurance and you don't have health care.
Let me ask another question. What happens if you don't have health insurance and you don't have health care?
So I have met a number of new patients in their 50s, and they said goodbye to their pediatrician at 18 for their last football physical,
Right.
and then they showed up in the emergency room at 50 with a heart attack. And they had to have had elevated blood pressure and cholesterol for at least a decade before they developed a heart attack. And what an incredible lost opportunity. And you can never make up that lost heart tissue. The other way that I get patients not referred from the ER, but you know, I've had a few gentlemen who have presented at 48, 52 with erectile dysfunction. That part of the body can be a barometer for the entire health. Same thing. Well, you know what? It turns out you have diabetes and you have hypertension. And that's why your body's not working the way that it's supposed to. And if this has happened, same thing. This issue has been occurring for 5 to 10 years already. I would have loved to have caught that problem earlier.
Young people in Massachusetts, where sort of the model for this national health
The test ground people have
Right.
referred to it as.
Right, the test ground. Young people actually felt pretty good about it. I mean, it's actually rather popular. One of the things that they did in Massachusetts was they got the Boston Red Sox to actually begin to promote this. And so if we use sort of sports celebrities, the celebrities, maybe we have a social media campaign, or if young people, they use video games and you sort of maybe put it in one of those advertisements inside of an Xbox or something like that, you can get it. It's just about meeting young people and telling them about these issues that have to be addressed, as you said, before it becomes a crisis at age 50 or 60 when they have a heart attack.
And that folds into the economic argument. So everybody wants to talk money now, right? So who's going to pay for this, and how do we shift who pays for healthcare and that? So in primary care over the long haul, okay, it's not just a medical service, it's a relationship. And it's a relationship in which people can begin to trust the doctor that they're with, and to be able to open up to them and to be able to really plan with them. You know, often a life well lived is a life well planned. And that kind of planning from a healthcare standpoint is done in the primary care office. And so if you can get people into that situation so they can actually start to really game plan when they don't feel bad at all, but they're 50 pounds overweight and they've got lots of habits. You know, for instance, they feel just fine smoking a pack of cigarettes a day. No problem, they feel the same as their buddy who doesn't smoke. It's too soon for them to feel bad yet. But that kind of intervention done over the long term, that saves tremendous money down the road. It also saves, from an economic standpoint, it saves productivity. So that 50-year-old would otherwise, you know, if they really got the care that they needed all the way through, they're still a happy, productive, you know, employed person, rather than having disability, other kinds of things which will cost, you know, both them personally, but then the system as a whole and our country as a whole, lots of money down the road. And for most people, having insurance is the ticket into that relationship, into getting into primary care. So you want people, even in this young cohort, to have insurance so they can start that process, you know, get the conversation that they're going to get in all of our offices, and start to make the changes which later have this huge watershed effect for the better.